I actually don't know of another program that does what Lunder Deneen's nursing preceptor program does. I think it's a model that all hospital systems and states should have, because usually when you learn to be a preceptor, either you learn it on your own. My many years of being a nursing preceptor, I learned it in the clinic setting. No one ever formally trained me, and over the years you create your own foundation. What Lunder Deneen, what this preceptor program does is you set the foundation, and then that allows them to just get better and better and better. So you kind of level up the quality of nursing within the state of Maine.
As a person in long-term recovery, I've experienced what I know to be very, very competent, caring physicians who just seem to lack the understanding around substance abuse and prescribing practices. Time to Ask greatest impact, I think, is the awareness it's raising among primary care docs and the broader community about the issues and opportunities that come with people that are struggling with addiction.
And we were one of the founding clinics to participate in the Time to Ask program. We still continue to work through the program with our staff. We have our new staff members coming on during orientation participate in the modules, so they're aware of how the program works within our organization. We've seen it extremely effective because we all know that the number one addictive substance people are using today is alcohol. And we want our staff to be prepared to really meet our patients where they're at. If it's not today, but maybe tomorrow that they need treatment. So we've really benefited from the program, and our team has.
The program really has been beneficial in many ways. However, I was most grateful for it when we were hit with a pandemic. This program helped to give my nurses the tools to onboard and precept new nurses coming out of school with varying levels of clinical experience. It helps my nurses to precept the travel nurses that were coming in from all over. It also helped us to bring in nurses from our outpatient settings during the height of the pandemic. I am ever grateful to the Lunder Deneen program and all of the wonderful team members that I had, and I am very appreciative for all of their support during the pandemic especially.
When we were approached by Lunder Deneen to participate in their oral health program developed for long-term care residents in Maine, I was very excited. As a registered nurse, I understand the impact that oral health can have on a person's overall health and wellness. With the education and tools provided to our staff, we have provided a better perspective for overall wellness just by helping our residents with their oral health care needs. We know that continuing to take care of your teeth and gums as an elderly person is important to prevent toothaches, tooth loss, and tooth decay. This can also be a big part of dignity and well-being.
I am so happy to have been part of the learning program through Lunder Deneen. It was a great experience for us to be able to bring back to our facility and completely revamp our orientation process for the nurses that came into our building. Both new grads and experienced nurses benefit from this program.
Time to Ask program empowered our clinical staff to have meaningful conversations with patients when performing alcohol use screening, and the educational take-home cards really helped patients understand how small changes could significantly improve their health. We appreciated that our entire staff was offered practical and motivational interview training, and we have plans to incorporate this training when onboarding new staff. We're looking forward to the upcoming workshop being offered by Time to Ask on alcohol withdrawal in primary care settings.
Lunder Deneen has assisted in providing the education and tools necessary to help navigate the widely misunderstood topic of dental care among our seniors in Maine. This roadmap has given positive progress towards good oral health in Maine, as well as with our long-term care facilities.
So Time to Ask for me is so worthwhile because it is changing a culture. It is making it a safe place for people to come to physicians' offices and seriously talk about their use of alcohol. So having this curriculum and training your staff truly is worthwhile and beneficial for both the patient and for the staff that are treating our patients.
The ability to provide caregivers with tools that will assist in the enrichment of their lives as well as their loved ones is crucial to our mission. What we have learned through Motivate at Home and what we will be able to pass on to the caregivers is both beneficial and essential.
We've seen the results here at 3 of our walk-in clinics, which is downtown Portland, with a response from our patients that they knew that they might have an alcohol use disorders, but this really brought it into fruition of what was going on with all the screening questions, and they were transparent to our doctors about their conditions, and we have seen a lot of improvements. Myself as a counselor in substance use disorders and alcohol use disorders have had a lot more patient clients, and so a success for Greater Portland Health and a success for Lunder Deneen offering for us to take part in this great event.
As a long-term care facility, we understand the need to expand our knowledge with oral health care. Lunder Deneen has provided us with the skills, or is providing us with the skills that are necessary to improve our knowledge, such as education and hands-on training. This will in turn better the lives of our residents.
I have been working with the Lunder Deneen team as an advisory board member and as an educator in their preceptor program since its inception. And I will say that as a teacher and as a teacher of new young nurses, the biggest impact that Lunder Deneen is having is on the practicing nurse, because those preceptors that come out of that program are top notch. And I tell my students, if you're looking for a job, look for where you can get a Lunder Deneen preceptor.